Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a patient called Mr. Morgan. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Morgan. It's good to see you today.
Hi, Doctor. Thanks for seeing me.
You're welcome. So, I understand you're here today because you've been experiencing some symptoms that might be related to hay fever. Is that right?
Yes, that's correct. I've been having a lot of sneezing, itchy eyes, and a runny nose for the past few weeks. It's been really bothering me.
I see. How long have you been dealing with these symptoms, Mr. Morgan?
It started about a month ago, and it seems to have gotten worse over time. I've never had allergies like this before, so it's all new to me.
That's understandable. Allergies can sometimes develop later in life. Have you noticed if these symptoms get worse at certain times of the day or in specific locations?
Yes, especially in the mornings when I go outside, and it's definitely worse when I'm in the garden or near trees.
That makes sense. It sounds like you may be dealing with seasonal allergic rhinitis, more commonly known as hay fever. This condition is caused by an allergic reaction to pollen from trees, grass, or weeds. Have you been exposed to these allergens lately?
I've been spending a lot of time outside recently because of the nice weather, and I think that's when it gets the worst.
It's quite common for people with hay fever to have flare-ups during certain seasons, particularly spring and summer, when pollen levels are higher. Do you have a history of any allergies in your family?
Yes, my mother has hay fever and my brother suffers from asthma. I guess I might have inherited it from them.
That could be a factor. Allergies often run in families. Let's take a look at your symptoms. Your nose is quite congested, and your eyes appear a bit red. This is typical for hay fever. Are you experiencing any other symptoms like coughing, wheezing, or a sore throat?
I've had a bit of a sore throat in the mornings, and sometimes I cough, but not too much. Mostly, it's the sneezing and itching that bother me.
The symptoms you're describing are common with hay fever. The sneezing, itching, and runny nose are the result of your immune system reacting to pollen, as if it were a harmful substance. The body releases chemicals like histamine, which cause inflammation and irritation in the eyes, nose, and throat.
That makes sense. It's just been so uncomfortable. Is there anything I can do to make it better?
Yes, there are a few options for managing hay fever. First, avoiding allergens when possible is key. I'd recommend keeping windows closed during high pollen seasons and limiting outdoor activities when pollen counts are high. Wearing sunglasses can help protect your eyes when you're outside.
I've been trying to avoid it as much as possible, but sometimes it's hard, especially when I have to go to work.
Understandable. In addition to reducing exposure, there are medications that can help. Antihistamines, which block the effects of histamine, can relieve symptoms like sneezing and itchy eyes. Nasal sprays such as corticosteroids are also very effective in reducing inflammation and congestion. Would you like to try one of these?
I've heard of antihistamines. Do they make you drowsy?
Some older antihistamines can cause drowsiness, but newer ones tend to be much less likely to have that effect. I can recommend a non-drowsy antihistamine that would be safe for you to take during the day. Nasal sprays typically don't cause drowsiness, but it's important to use them as directed for the best results.
That sounds good. Are there any other treatments I should consider?
Another option is allergy shots, or immunotherapy. This is a longer-term treatment where small amounts of allergens are injected over time to help your body build up a tolerance. It's usually recommended if symptoms are severe and other treatments aren't effective.
I didn't realize there were so many options. I'll try the antihistamine and nasal spray for now and see how that goes. How long should it take before I feel some relief?
You should start feeling better within a few days of using the antihistamine and nasal spray. If your symptoms don't improve, or if they worsen, we can consider other options. It's also a good idea to monitor your symptoms and keep track of any changes, especially as the pollen levels fluctuate.
Sounds like a good plan. Thank you for the information, Doctor.
You're very welcome, Mr. Morgan. I'll have the nurse give you the prescription for the antihistamine and nasal spray. If you have any questions, or if your symptoms don't improve, don't hesitate to reach out. Take care, and I hope you start feeling better soon.
Thanks again, Doctor. I'll follow up if I need anything else.
Extract 2. Questions 13 to 24. You hear a GP talking to a patient called Anna Bellamy. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, is this Anna Bellamy?
Yes, that's me.
Great. So, what brings you in today?
Well, I've been feeling quite unwell lately. It started with a bit of pain around my right side, near my ribs. I didn't think much of it at first, but then a rash appeared in that area, and it's been hurting a lot.
I see. I'm sorry to hear that. Can you tell me a little more about the pain? When did it start, and how would you describe it?
It started about 3 days ago. It's kind of sharp and burning, like someone's poking me with needles. It wasn't too bad at first, but it's been getting worse. The rash appeared a day or so later, and it seems to be spreading.
Right, so, burning pain and a rash that appeared after the pain, that does sound concerning. Given your age and symptoms, one possibility that comes to mind is shingles, or herpes zoster. It's caused by the reactivation of the chickenpox virus, which can remain dormant in your body for years. Does that sound like something you've heard of?
Yes, I've heard of shingles, but I didn't realize it could affect me like this. I had chickenpox when I was a child, so I guess that makes sense.
Exactly. The virus can remain dormant in your nerve cells for many years, and stress, a weakened immune system, or other factors can trigger it to reactivate. The rash you're describing is often localized to one side of the body and follows a specific nerve pathway.
That's exactly what it looks like, just on one side of my rib cage. It's not just the rash, though. The pain is intense. Is there anything I can do to stop it from getting worse?
The pain associated with shingles can be quite severe. There are antiviral medications that can help reduce the severity and duration of the outbreak if started early, ideally within 72 hours of the rash appearing. You'll also want to take pain relievers to manage the discomfort. I'll also prescribe you some antiviral medication today, like acyclovir. It's important that you start it as soon as possible to help speed up your recovery.
Is there anything else I should know about shingles? I've heard it can cause complications.
Yes, shingles can lead to a few complications. The most common one is postherpetic neuralgia, which is persistent pain in the area of the rash that continues even after the rash has healed. This can be particularly troublesome, especially for older adults.
That sounds scary. Is there anything I can do to prevent that from happening?
The antiviral treatment can help reduce the risk of long-term pain, but there's no guarantee. The key is to manage the pain as effectively as possible while the virus is active. I can prescribe a topical cream to soothe the rash and some stronger pain relief medication to help manage the burning sensation. If you're feeling quite uncomfortable, a short course of corticosteroids may help as well.
What about my immune system? I've been a bit run down recently, stress at work and some personal issues. Could that have contributed?
Yes. Stress and a weakened immune system can definitely make you more susceptible to shingles. The virus tends to reactivate when your body is under strain. So it's important to take care of your overall health during this time. If you're finding it difficult to manage stress, I'd recommend speaking with a counselor or therapist to help ease the load.
I didn't realize stress could have such an impact. I'll definitely think about it. What about the rash itself? Is it contagious?
Yes, the rash is contagious, but only to people who have never had chickenpox or who haven't been vaccinated against it. However, it's most contagious while the rash is still blistering. Once the blisters have crusted over, you're no longer contagious. It's best to avoid close contact with people, especially those who are immunocompromised or pregnant, until the rash has healed.
That's helpful to know. I'll make sure to keep my distance from others while I'm contagious.
Good plan. So, just to summarize, I'm going to prescribe you some antiviral medication to start right away. I'll also provide pain relief options and a topical treatment for the rash. If the pain doesn't improve, or if you develop complications like persistent pain after the rash is healed, we'll discuss further treatments.
Thanks, Dr. Jameson. I feel a little better knowing there's a treatment for it.
You're welcome, Anna. I'll check in with you in a few days to see how you're doing. Make sure to rest and stay hydrated while you recover. And if you have any questions, don't hesitate to reach out.
Will do. Thanks again.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 trainee doctors talking to each other. Now read the question.
So, what's the first task we need to work on today?
We're going to take part in some role-playing scenarios. We have to practice communicating with patients in different situations, such as delivering bad news, explaining treatment plans, and handling difficult patients.
That sounds interesting. And do we need to stick to a specific scenario?
No, the idea is to cover a range of situations. The goal is to practice our communication skills and problem-solving abilities, so we can handle real-life challenges more effectively. After each scenario, we'll discuss what went well and what could be improved.
Okay, that makes sense. Let's get started then.
Now look at question 26. You overhear a conversation between an intern and a senior neurologist in the clinic. Now read the question.
And speech difficulty. The symptoms began after waking up this morning and have been progressively worsening. He has a family history of early onset strokes, with both his father and uncle having suffered strokes in their early 30s. On examination, the patient has hemiparesis on the left side, and speech is mildly slurred. We performed an MRI of the brain, and here is the result.
So, what do you think is the diagnosis?
Based on the clinical presentation, family history, and MRI findings, this appears to be CADASIL, cerebral autosomal dominant arteriopathy with subcortical infarct leukoencephalopathy. It's a rare genetic disorder that causes multiple strokes and can lead to cognitive decline, often in young adults. The MRI shows typical changes, including subcortical infarcts and leukoencephalopathy, which are characteristic of CADASIL.
What is your next step in managing this patient?
We would recommend genetic testing to confirm the diagnosis, followed by management of vascular risk factors and potentially starting medication to address the strokes.
Now look at question 27. You hear a nurse explaining about emergency situations. Now read the question.
As you all know, our hospital regularly faces emergency situations, ranging from natural disasters to large-scale accidents. Starting next month, we will be implementing an updated emergency response training program for all staff. This program will focus on disaster preparedness and patient evacuation protocols. The aim is to ensure that we are all well prepared to respond quickly and effectively in the event of a crisis, ensuring the safety of both patients and staff. The training will cover various emergency scenarios, including fire evacuations, medical emergencies, and evacuation of patients with special needs. We recognize that this will require collaboration and practice, and that the success of this program depends on everyone's active participation. Any questions or concerns regarding the training can be directed to Mark in the Safety and Compliance Department.
Now look at question 28. You hear a nurse talking about a patient. Now read the question.
This is Emily Davis. She's a 7-year-old girl who has been brought in with a high fever and flu-like symptoms. She's been complaining of body aches, a sore throat, and a persistent cough. We've started her on fluids to keep her hydrated, but her fever is still quite high, around 39 degrees Celsius. We've also given her some ibuprofen to manage the pain.
I see. Has she been able to keep fluids down so far?
Yes, she's been drinking water and some clear broth, but she's been a bit lethargic and not very interested in eating.
Right. Let's continue with the fluids and monitor her fever closely. I think we can also give her some paracetamol for her fever if it doesn't come down after the ibuprofen. Let's aim to keep her comfortable while we watch her progress over the next few hours.
That sounds good. I'll make sure we keep her well hydrated and continue monitoring her temperature.
Now look at question 29. You overhear a conversation between a nurse and a social worker about a patient's request for some time outside the ward. Now read the question. I understand Mr. Harris wants to go for a walk outside, but has been really struggling with his anxiety lately.
But he's been in here for weeks now and is mentioned feeling like he's losing touch with reality. A change of scenery might help him.
I agree that a change of environment could be beneficial, but he's still having a lot of panic episodes. I don't want him to become overwhelmed outside the ward.
Maybe we can go with him just for a short walk around the hospital grounds. It might help him feel more grounded.
I'd prefer to wait until he has a little more stability with his therapy sessions. I'm worried that pushing him too soon could worsen his mental state. Now look at question 30. You hear a surgeon talking before a patient's procedure. Now read the question.
How are you feeling today? I'm Dr. Adams, and I'll be performing your rotation plasty procedure today. Are you ready to discuss the surgery?
I've been reading about it, but I'm still a bit confused. Can you explain it to me in simple terms?
Of course. The idea behind rotation plasty is that we'll be removing the lower part of your leg, including the ankle joint. Then, we'll rotate the remaining part of your foot 180 degrees and reattach it to your thigh. The foot will function as your new knee joint.
So, my foot will be where my knee is?
Exactly. It may sound a bit strange, but the foot will be positioned in such a way that it will allow you to use a prosthetic more effectively. This way, the prosthetic will be more stable and functional.
Will I be able to walk again with it?
Yes, the goal is to give you better mobility. Once the surgery heals, you'll be able to use a prosthesis that fits securely into your newly positioned foot, allowing you to walk and even run more effectively than with a traditional amputation.
Okay, I think I understand it better now. Let's go ahead.
Great, let's get started then.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Godlin Jess, an expert in public health policy from the University of Oxford. You now have 90 seconds to read questions.
Hello, and welcome to Health Research Roundup. One of the most pressing issues in public health today is vaccine hesitancy. Despite the overwhelming scientific evidence supporting the safety and efficacy of vaccines, many people remain hesitant to get vaccinated. Today we are joined by Dr. Godlin Jess, an expert in public health policy from the University of Oxford, to discuss the reasons behind vaccine hesitancy and how healthcare systems can address this issue to protect public health. Dr. Jess, welcome.
Thank you for having me. It's a pleasure to be here.
To start with, Dr. Jess, can you explain why some people are hesitant to get vaccinated, despite the vast amount of research showing that vaccines are safe and effective?
Certainly. Vaccine hesitancy is a complex issue, and there are several factors at play. One major factor is misinformation. With the rise of social media, people are exposed to a lot of false or misleading information about vaccines, which can create doubt. This can include everything from exaggerated risks of side effects to conspiracy theories about the motives behind vaccination campaigns. Another factor is mistrust in institutions. Some people may be skeptical of the healthcare system or government authorities, particularly in marginalized communities that have experienced historical mistreatment. These experiences can create a sense of distrust, leading people to question the motives behind vaccination campaigns. Finally, there's also the issue of complacency. In countries where diseases that vaccines protect against are less common, people may feel that the risks of not getting vaccinated are low because they don't see the diseases in their everyday lives.
As a result, they may be less motivated to get vaccinated.
So in essence, vaccine hesitancy isn't just about a lack of knowledge, it's also about a combination of fear, mistrust, and perceived risk. How can public health systems address these concerns and encourage people to get vaccinated?
The key to addressing vaccine hesitancy is through clear, transparent communication. Healthcare systems need to engage with the public and provide factual, science-based information. But it's not enough to simply tell people that vaccines are safe. We also need to acknowledge and address their concerns. People are more likely to listen to experts when they feel that their concerns are being taken seriously. One effective approach is using trusted community leaders to spread accurate information. For example, in many communities, people may be more likely to trust local doctors, religious leaders, or even celebrities who openly support vaccination. These influencers can help bridge the gap between the healthcare system and the people who are hesitant. Another strategy is to make vaccination more accessible. This can include reducing costs, offering vaccines at convenient locations, and expanding hours for vaccination clinics. When people don't have to go out of their way to get vaccinated, they are more likely to do so.
That's a great point. Community engagement is vital in building trust. But do healthcare systems have any role in combating misinformation, particularly on social media platforms?
Yes, absolutely. Misinformation on social media is one of the biggest challenges we face today. Social media allows false information to spread rapidly, and it's often more emotionally charged than factual content, which makes it harder to counter. One thing healthcare systems can do is to actively monitor and debunk misinformation. Many organizations are already doing this by working with social media platforms to flag harmful content and provide accurate information. In addition, healthcare professionals need to be equipped with the skills to respond to vaccine hesitancy online. This includes training healthcare workers to engage in constructive online conversations with people who are hesitant, using facts to debunk myths and misconceptions. It's a delicate process, but it's necessary to ensure that the correct information is circulating.
It sounds like there's a multi-pronged approach needed to tackle this issue. But are there any specific examples where these strategies have been successful in increasing vaccination uptake?
Definitely. One excellent example comes from the United Kingdom during the rollout of the COVID-19 vaccine. The National Health Service (NHS) worked closely with local communities to ensure that information about the vaccine was culturally relevant and trusted. They partnered with community groups, religious leaders, and grassroots organizations to host informational sessions and encourage vaccination. This helped to build trust in the vaccine and reduce hesitancy. Another example comes from the United States, where states like California and New York have implemented school vaccination requirements. These mandates, combined with outreach programs that provide education and access to vaccines, have helped increase vaccination rates, particularly in areas with lower uptake. When people see that their children's education depends on vaccination, they are more likely to get vaccinated themselves.
Those are great examples. It seems that community-based approaches and clear, transparent communication can have a significant impact. But what role do individual healthcare providers play in overcoming vaccine hesitancy?
Healthcare providers play a crucial role in addressing vaccine hesitancy. When patients trust their healthcare providers, they are more likely to listen to their advice and recommendations. This means that doctors, nurses, and pharmacists need to be prepared to engage in conversations about vaccines with their patients. They should be ready to answer questions, dispel myths, and provide evidence-based guidance. Training healthcare providers to have these conversations is key. They need to be empathetic, patient, and non-judgmental. It's also important for healthcare providers to lead by example, getting vaccinated themselves and encouraging their colleagues to do the same. When people see healthcare professionals confidently advocating for vaccines, it sends a powerful message.
It's clear that healthcare providers have a pivotal role in influencing vaccine acceptance. Finally, Dr. Jess, in your opinion, what is the long-term impact of addressing vaccine hesitancy on public health?
Addressing vaccine hesitancy is vital to the future of public health. When more people get vaccinated, we can achieve higher levels of immunity in the population, which helps protect those who cannot be vaccinated due to medical reasons, such as infants, pregnant women, or people with compromised immune systems. This is known as herd immunity, and it's essential for preventing the spread of infectious diseases. In the long term, reducing vaccine hesitancy can also prevent the resurgence of diseases that were once under control. Diseases like measles, whooping cough, and even influenza can make a comeback if vaccination rates drop too low. By combating hesitancy and increasing vaccination coverage, we are not only protecting individuals, but also strengthening the public health infrastructure as a whole.
Extract 2. Questions 37 to 42. You hear Dr. Elena Richardson giving a detailed presentation on regenerative medicine and stem cell therapy. Now, read the questions. You now have 90 seconds to read questions.
Hi, I'm Dr. Elena Richardson, and today I'd like to discuss one of the most exciting fields in modern medicine, regenerative medicine and stem cell therapy. These therapies have the potential to revolutionize the way we treat a wide range of diseases, injuries, and even aging processes. Stem cells, as many of you may know, are undifferentiated cells capable of transforming into various types of cells in the body, including muscle, nerve, and skin cells. This remarkable ability allows stem cells to repair and regenerate tissues that have been damaged by injury, disease, or aging. One of the most significant breakthroughs in regenerative medicine has been the use of stem cells to treat chronic conditions such as heart disease, diabetes, and even neurological disorders like Parkinson's disease. For example, in heart disease, where the heart muscle is damaged and unable to repair itself, stem cell therapy could help regenerate healthy heart tissue, restoring function to the heart and improving a patient's quality of life. Similarly, in conditions like type 1 diabetes, stem cells can potentially replace the damaged insulin-producing cells in the pancreas, offering a promising treatment option for patients who currently rely on insulin injections. But how exactly does stem cell therapy work? Well, the process typically begins by harvesting stem cells from the patient's own body, usually from the bone marrow or fat tissue. These cells are then cultivated and potentially reprogrammed to become the specific type of cell needed for the treatment. For example, stem cells can be turned into cardiac muscle cells to repair damaged heart tissue, or into neurons for patients with neurodegenerative diseases. Once ready, the stem cells are injected into the damaged area where they begin to integrate into the tissue and stimulate healing processes. Regenerative medicine doesn't stop with stem cell therapy though. It also includes the development of bioengineered tissues and organs, which have the potential to replace organs that have failed or been severely damaged. In the future, we may see the development of lab-grown organs, such as kidneys or livers, that can be transplanted into patients without the need for donor organs. Scientists are also exploring the possibility of 3D printing tissues using a patient's own cells, which would eliminate the risk of rejection and improve the success rates of organ transplants. A good example of this kind of bioengineering is the development of 3D printed skin for burn victims. Traditional skin grafts can be painful and sometimes ineffective, leading to complications. However,
Using a patient's own cells to print skin can drastically improve healing time and reduce the risk of rejection. These advancements in regenerative medicine are not only life-changing, but could eventually help alleviate the shortage of donor organs, which remains a significant challenge in the medical field. While the potential of regenerative medicine is incredibly promising, it's important to note that this field is still in the early stages of development. Many of these therapies are still experimental, and there are significant challenges to overcome, such as ensuring the safety and effectiveness of treatments, managing the ethical implications of stem cell research, and making these therapies accessible to patients. Additionally, there is ongoing research into the best ways to deliver stem cells to the target tissues and ensure that they integrate properly into the body. Looking ahead, I believe the future of regenerative medicine holds immense promise. As research progresses, we can expect more treatments to become available, offering new hope for patients with conditions that are currently considered untreatable. With ongoing advancements in stem cell research, tissue engineering, and bioprinting, we are on the verge of a new era in medicine, one where the possibilities for healing and regeneration are virtually limitless.
That is the end of Part C. You now have 2 minutes to check your answers.